All right, so here we are. It's spring and the weather, it's warmer, and it's time to get outside, get some yard work done, a lot of activities, but pain can keep us from staying active and fit, especially when it comes to our back and spine. So here today to talk to us about that is Dr. Joseph Stern. He is a neurosurgeon in Greensboro, and he's joined by one of his patients, Shirley Coble, who you experienced a back pain. You said started in the 80s. Tell me about what you experienced.
Well, it was just back pain, and usually the chiropractor could help me. Well, I went to chiropractors for some time, and it worked, but there came a point where it didn't work any longer. I had more issues coming along and severe pain, and so it just didn't help anymore, and I had to seek other help.
What limitations did you have when it comes to doing different activities, whether it was with family or just being physical?
Well, starting in January, I couldn't drive any longer. It was very painful to walk. I couldn't sleep in my bed. I couldn't lay down in my bed from December until after I had my back surgery. I couldn't even lay in the bed.
Wow.
And it was horrific. It was the worst pain I've ever experienced.
She surely had to lay forward, sit on a chair and lay forward, put her head in a pillow to get a couple of hours of sleep a night.
I was just about to say, Dr. Stern, so many people are watching this going, that sounds so familiar to me. What do they do? When does the process come when they say, you know what, I need to take this a step further and see someone like yourself?
I think that Shirley is a good example of that. She basically tried to contend with it, was taking anti-inflammatories, taking prescription pain medicine, trying to manage it, and it was just not manageable. And when she came to see me, she was just in miserable pain and not able to function.
And then what type of surgery does this require as far as the recovery process?
So she had a difficult situation, a complicated situation, in that she has what's called complex spinal deformity, or scoliosis. Okay. So when she came to see me, she was very tipped forward. She was not able to stand up straight. And if you look at her x-ray on the monitor, you can see that her spine was very curved. And on the side views of her spine, the bones were actually sliding off of each other. And on top of that, she had a big ruptured disc that was causing lots of pressure on her spinal nerves. The problem is not just one or two levels in her back, but basically the curvature of her entire spine. So we used a computer to generate a plan of how to basically rebuild her spine.
Wow. And
did that in surgery over 2 days from 3 different approaches. And you can see on the screws and rods that are in her back, basically realigning and restructuring her back.
How long did you notice between the surgery and the time when you started to feel better?
Well, I felt better immediately. I mean, I could lay in the bed. That was
something so small. I mean,
yes.
It makes a huge difference.
And but it took 2 months really of different therapies, and home therapy and walking and that type of thing. And I had an amazing daughter-in-law that stayed with me for 2 months, 24/7.
Very good.
I was blessed, and I really feel like the Lord led me to Dr. Stern because I prayed and prayed and prayed, and I'd hoped that the Lord would do it himself, but sometimes he sends us other ways to get our miracle, and it was a miracle through the skill and the wisdom of Dr. Stern, and I can't say enough about that because, he and the Lord gave me my life back.
Changed your life for sure.
Absolutely.
She's not taking any pain medicine at all now.
Wow.
Now, after July 26, 2016, I had the surgery. In April 2016, July 26, I took my last pain med and have not had anything, not even Advil, not Tylenol, not anything
well,
since
that
then.
means there's hope for so many people out there who are watching this morning. Thank you both so much for stopping in and sharing your story with us.
Thank you for having us.
Thank you.